Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Wonka. Here are some of the highlights this hour. Today, President Muhammadu Buhari addresses the nation tonight, still on the COVID-19 lockdown. COVID-19 cases in the country now at 1,273 across 32 states and the Federal Capital Territory. And our theme this evening, we look at the deportation of the Almajiri children to their home states and the psychological impact. President Muhammadu Buhari will address the nation today at 8 p.m. The president's nationwide broadcast is expected to address the current lockdown in place in the FCT, Ogun and Lagos states and the efforts to containing the spread of the COVID-19 virus in the country. In his maiden address in March, the president declared a 2-week lockdown, extending it by another 2 weeks, April the 13th. There are way over 1 million positive cases of COVID-19 confirmed across the world, with thousands of deaths recorded in many countries. Now, our theme this evening is on the Almajiris, a system of Islamic education practice in northern Nigeria. The name also goes for the young boys who learn and study within the system. With the COVID-19 pandemic, there has been deportations of Almajiris to their state of origin. It was started by Nasarawa State, Kano and Kaduna, and a few other northern states doing the same thing. What is the consideration for the evacuations? We'll be getting answers to some of these questions a little later on the program. Now let's take you to the latest figures from the Nigeria Center for Disease Control, NCDC, confirming the total of 1,273 cases following the announcement of 91 cases last night. The death toll has also increased to 40 and 239 persons have been discharged. The latest figures show that COVID-19 has spread to 32 states of the Federation and the FCT, Lagos leading the pack with 731 cases, followed by Abuja 141 and Kano 77 cases. Other states, here's a breakdown. Ogun and Gombe states follow with 35 cases each. Osun has 34 cases, Katsina and Borno 30 each, Edo 25, Oyo 21, Kaduna 15, Bauchi 14, others are Akwa Ibom 12, Kwara 11, Sokoto 10, Ekiti and Ondo 8 each. We have Delta, Rivers and Taraba states with 6 cases each. Abia, Enugu, Niger, Jigawa and Zamfara have 2 cases each, while Benue, Anambra, Adamawa, Plateau, Imo, Bayelsa, Ebonyi and Kebbi have 1 case each. And the Kano state government has been restricting movements, especially those who could be susceptible to coronavirus, and it's a strategy fast being adopted by state governments. In the past few days, the Kano state government has evicted over 1,000 children, some of whom have been sent back to their states in the northern region. Kaduna also recently evacuated 30,000 Almajiri children as part of measures to contain the spread of the virus.
We have so far evacuated a total of 1,098 Almajiri into the 3 states that I just mentioned, Katsina, Jigawa, and Kaduna. And tomorrow, by God's grace, we are going to evacuate over 100 Almajiri into Bauchi state, Your Excellency, by tomorrow, by God willing. And we will continue to evacuate this Almajiri until we make sure all the non-indigenous Almajiri were taken into their various states. Before we start moving this Almajiri, we collaborated, as you directed, with the Ministry of Health. They were all tested before we evacuated them into their various states, and I'm happy to say that none of them were positive. On the 22nd of April, we evacuated a total number of 524. Total number of 524 to Jigawa State Government.
196 Almajiris have arrived Bauchi from Plateau State. Among them, we hear are 7 Malams. They were received by the Deputy Governor of the state at the General Hassan Usman Katsina College, where they are taking shelter before being sent to their respective local government areas. Our correspondent Hajra Aliyu also reports on more Almajiri children expected today from Kano.
What we know for now about the first batch of Almajiri evacuees that have been received in Bauchi State from Plateau State is that they are being observed, and any moment from now they will be reunited with their families. The Deputy Governor of Bauchi State, who is also the chairman of the COVID-19 task force, has explained that they will not be isolated for the period of 14 days simply because they are coming from a non-high-risk COVID-19 state. But this is raising concern among health workers.
It is unfortunate in the sense that it is coming only now when these children are likely going to be a potential means of further spread of this pandemic disease. As we all know, studies have shown that a large percentage of these children are below the age of 10, and significant numbers still are below the age of 10 to 15. Only very few of them are about 16. So if you look at it, these are age categories that are highly dependent. They cannot cater for themselves, so they cannot take decisions on their own in order to protect themselves. As a matter of fact, what we are hearing right now, quite a number of them don't even know about the existence of the virus. So they are highly at risk and they are highly vulnerable. They roam the streets, they are everywhere in public places without any protective measures.
Sometimes our leaders tend to be providing short-term solutions to long-term problems. You know, this is something that has to be looked into holistically. It is not just enough to just be ferrying these children from one state to the other. There has to be a concrete plan in place, not only to, take these children back to their parents, but also to put up in place policies and laws that will stop, even other people from allowing their children to go for these things.
We understand that 700 Almajiris are being expected from Nasarawa State, while over 100 are being expected from Kano State. And any moment from now, the Bauchi State government will also begin evacuation of Almajiris to their respective states. So we cannot place a figure to the total number of returnees and also the ones that will be evacuated to other states until the process is concluded. From Bauchi State, Hajira Aliyu, Channels Television.
In the meantime, 607 Almajiri children, that's the figure the Jigawa state government has put under 14 days quarantine after they were evacuated from Kano State. The State Commissioner of Health, the chairman of the state's task force on COVID-19, Dr. Abba Zakari, disclosed that the children are being isolated at the NYSC camp in Jigawa. According to him, the measure is necessary to avoid possible spread of COVID-19 as they are coming from a state, the third highest number of infected persons in the country.
These children may not have seen this coming, but the reality is that they are being sent packing from their original base, and this is certainly disrupting their lifestyle and sense of livelihood. Packed in these buses are Almajiri children who've been evicted from Kano State as part of measures by the state government to curtail the spread of COVID-19. About 600 of them have been brought to the NYSC camp in Kiawa, Jigawa, and they will be here for 14 days before being allowed to join their parents and family.
The essence of keeping them here is they were moved from Kano, and Kano is is one of the states that is the third state, I think, in the country with the largest number of COVID-19 cases. And the Almajiris, they move from house to house within the community. So there is high chance that, one of them could pick the ailment. And aside that also, they intermingled in Kanu before coming here. So we decided to quarantine them for about 14 days.
If any does test positive to the virus, this multipurpose hall, being converted to an isolation center, will serve as the treatment unit.
With this pandemic, putting together all the children in one place and taking them down, we might be risking the children and probably potentially their parents when they go there. So at this time, I don't have that intention. Maybe after the pandemic, when it becomes necessary to do it, we'll do it. But right now, all kind of citizens and other citizens Al-Majri that are in Jigawa State, we'll try to see how we secure them. We feed them while they are not in school, except if the parents want to take them, then we screen them and send them to the parents.
While the state government strives to make them comfortable after receiving them into the state, for now, test samples will have to travel to Abuja and back before further medical decisions are made. Abuja has become the center of analysis for most northwestern states following the closure of the Kano Center, which is waiting to be reopened any time from now.
Joining us right now from our Abuja studio is a psychologist, Dr. Issa Afiana from the Department of Psychology, Bayes University, Abuja. We'd like to thank you for joining us on the program. I must first ask you, with the repatriation of our Almajiri children taking place across the northern states, do you think that this is a COVID-19 scare, and perhaps the northern governors are doing this in the best interests of the children?
Thank you very much for having me. You see, the issue of Al-Majri is a national issue. It has just become so glaring because at this time of the COVID-19, the gathering of these children poses serious health hazards and challenges. So the best thing to do is to put them in such a place that they can be looked at, see whether any of them have contacted the virus, and take all necessary steps to make sure that, that it does not circulate or into the society from which these Almajiris are all embedded in. Yes.
One can begin to imagine what will be going through the minds of the children. We also know that they include some malams who are a little older, but then we also know that some of them are orphans. What do you think the psychological impact is on their minds?
Yes. Psychologically speaking, these children need adult guidance and protection, and if they are left alone like that, the developmental stages they ought to take in order to mature to become useful citizens in the country will be truncated. So to that extent, Nigeria as a country must take serious steps to see that the Almajiri system gets the desired attention it needs for these children to grow and to become useful citizens in the future building of this country. I can tell you that we don't know, but there may be some good endowed children in the Almajiris that can be medical doctors tomorrow, that can be engineers, that can invent things that can help in development of this our country, Nigeria. If we neglect them and disregard them, the chances are that we will lose that, and that will be a loss to the country, and which can be irretrievable.
All right. I just must quickly ask, because the Secretary to the Government of the Federation, Chairman of COVID-19 PTF, said that we're building an army if we don't cater to them and turn them into productive citizens. But what kind of risks do you think the state governments are also taking, moving them around in such a manner?
Well, the state government has capacity to accommodate these people in their various states. I don't see why they should move them to other places. The only thing they need to do is to become, innovating and find a place where they can keep these things, because the movement of these children from one place to the other is in itself is hazardous. So the state government should find within themselves a portable place, a suitable place with which to keep these children and take care of them, at least for the period of this COVID, so that it does not allow them to move around the states and move around other places. I think the state should be able to do that.
Appreciate your time on the program, Dr. Isa Afiana from the Department of Psychology based University Abuja. Thank you for joining us.
Thank you very much. Thank you for having me.
COVID-19 updates continue shortly. Join us again. Also on the issue of Almajiri children that are being repatriated to their home states, the Secretary to the Government of the Federation earlier today at the Presidential Task Force on COVID-19 briefing has been speaking on that issue, where he said the context of providing for them the safety and security in the wake of the pandemic. Mr. Mustafa says it was a decision taken by the northern governors and the repatriation is done in their best interest. He said the country might be building an army if they do not cater to them and turn them into productive citizens. He says preparing their Almajiris for the future is very important. Well, joining us at this point on limiting as well the spread of the pandemic is Dr. Oluchi Kama Okafor, consultant public health physician. Thank you for joining us on the program. I must first ask you about the Almajiri situation, the repatriation. We spoke earlier to a psychologist who was talking about the impact on their minds and their health. But what do you think should be perhaps the position in terms of welfare for these children?
Thank you for having me on the program. In my opinion, moving the children around, and I'm sure within that movement, they will not be observing the measures that are necessary to keep them healthy, to keep them safe, might not be the best option. If it is possible, if we can locate them safely where they are, or find a good strategy when it comes to moving them, that's very important, because we know the kind of virus we're dealing with, and we know the situation when it comes to the degree to which it spreads. So those measures are important to be maintained.
I'd like to ask you your thoughts. The Minister of State for Health at the briefing today said that one of the reasons why we're having the community transmission and the numbers are that there are some unauthorized treatment of COVID-19 symptoms in Nigeria. Why do you think this is happening?
Well, what we have to consider is that the kind of virus we're dealing with is one that spreads within the community, and we've started seeing a community spread. So that the measures that we're taking right now should be such that we can mop up those within the community who we can identify. And so these measures we're taking, like the house-to-house screening, the testing that is going on, is important to help us contain the virus as much as possible.
But the truth is, have we learned any lessons from the lockdown in the states, Lagos, Abuja, Ogun State? And in your perhaps medical point of view, do you expect a further lockdown to even include more states, or would you say we should go the way of the Nigeria Governors Forum and have the interstate lockdown?
First of all, the lockdown is a very important measure, and I can say that most of the gains we've made have been because of the lockdown. Now, what I would propose is what I call a strategic reopening, because of, once again, the kind of virus we're dealing with. The focus should be to, as much as possible, keep people apart. Now, whether it's interstate or within states, we should have a strict protocol when it comes to reopening. For example, when you are talking about infectious disease prevention and control, using personal protective equipment, like most people are proposing that we should open up and then use our equipment, they're not the first line things to do. So as much as we don't like the lockdown, it's important to understand that it's necessary. And then that the very next steps should be strategic. It should be done such that we can still keep our control.
Time on the program, Dr. Oluchi Kama-Okwafo, consultant public health physician. Thank you for joining us.
Thank you.
The National Commission for Migrants, Refugees and Internally Displaced Persons have distributed food, non-food items worth millions of naira to over 100,000 internally displaced persons in Benue State to mitigate the effect of the COVID-19 lockdown. Presenting the items, which includes 350 bags of rice, among other foods and other consumables, the National Commissioner, Senator Bashir Mohammed Garba, assures the IDPs have government support through the difficult transition period of their lives.
According to our records, we have over 100,000 refugees and IDPs in Benue State. As an agency that is mandated to provide care and maintenance to this vulnerable group, we'll continue to do our best to make their lives better. I want to use this opportunity to thank Mr. President for his passion, support, and commitment towards alleviating the suffering of our persons of concern.
And at the Presidential Task Force briefing today, the Secretary to the Government of the Federation and Chairman of the Task Force confirmed that progress has been achieved in the last 4 weeks, but there's still so much to be done. Mr. Mustafa also said there will be more efforts towards aggressive testing, contact tracing and prevention control.
Or unaccredited. The Presidential Task Force shall continue to pursue the strategy of aggressive testing, detection, isolation, contact tracing, care and management. Similarly, non-pharmaceutical measures will be enhanced. Over the last 4 weeks, we have made appreciable progress, but we are not yet out of the woods because a lot more is required to be done. Nigerians at all levels must take responsibility for our actions, adopt behavioral modification, ensure compliance with advisories, and provide guidance to our followers and the youth. I want to thank our frontline health workers and administrators again and again who have been working to keep every Nigerian safe. Your professionalism and commitment are well appreciated, and I urge you to continue with strength and vigor. Finally, let me remind all Nigerians that the fight against COVID-19 is a fight for all of us, and I urge you to continue with strength and vigor. All states.
The Minister of State for Health advised persons with underlying health conditions to avoid having visitors this period. He said the best way to stop the spread is for everyone to join the fight, observe good respiratory hygiene and respect guidelines set out by government.
All states have been supplied with medical. Use non-contact greetings such as waving, nodding, or placing a hand over your heart. The elderly and those with pre-existing medical conditions such as cardiovascular disease, diabetes, liver disease, kidney disease, chronic respiratory disease, and cancer should avoid receiving non-essential guests, especially at close quarters at this time. And of course, the use of masks or face coverings over your nose and mouth if you must leave your home is highly recommended.
The Nigeria Center for Disease Control continues to work closely with states. You can find the latest national strategy to scaling up access to coronavirus disease testing in Nigeria and other public health advisory. Also, the World Health Organization's website. Each moment, there are regular updates about the spread of the pandemic. You can also find practical guidance for strategic action that is tailored to local content. That's our COVID-19 update at this time. Another update comes your way again at 9 p.m. I'm Millicent Walker. Bye for now. Stay safe.